WHO definition of the health. Health is a state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity. In recent years, the ability to lead a socially and economically productive life has been added to the concept. Changing concepts of health, biomedical concept, ecological concept, psychosocial concept, holistic concept. Dimensions of the health. Physical dimension, a perfect functioning of the body, cells, organ and systems. Mental dimension, a state of balance between the individual and a surrounding world. Social dimension, quality and quantity of an individual's interpersonal ties and extent of involvement with the community. Spiritual dimension involves purpose in life, principles, and ethics. Other dimensions emotional, vocational, and political dimensions. Determinants of the health. Health is a multifactorial. The main determinants includes biological, genetic makeup, age and sex, behavioral and social cultural, lifestyle habits, smoking diet, cultural beliefs, environmental, safe water, sanitation, housing and air quality, social, economic, income, education, occupation, health system, availability, accessibility and affordability of health services. Concept of well-being. Physical quality of life index consolidate three indicators: 1. Infant mortality rate, 2. Life expectancy at age 1, 3. Literacy. Measured on a scale of 0 to 100, it doesn't measure economic growth. Human Development Index combines three dimensions: life expectancy at birth, to knowledge, adult literacy rate, and mean year of schooling. 3. Income, real GDP per capita in triple P. Values ranged from 0 to 1. Concept of disease. Distinction of terms. Disease, a physiological, psychological dysfunction, a subjective state of the person who feels aware of not being well. Sickness, a state of social dysfunction, a social rule assumed by individual. Theories of disease causation: germ theory, epidemiological triad, multifactorial causation, web of causation. Germ theory: one single specific microorganism causes one specific disease, one to one relationship. Epidemiological triad: disease result from interaction between agent, host, and environment. Multifactorial causation, especially for non communicable diseases, chronic heart diseases, cancer, where multiple factors, lifestyle, genetics, environment, combine to cause disease. Web of causation suggests that effect never depends on a single isolated cause. The course a disease takes in individual from its pathological onset until its eventual resolution through complete recovery, disability, or death in the absence of intervention. Pre-pathogenesis phase, pathogenesis phase. Pre-pathogenesis phase contains the period preliminary to the onset of disease in man. In disease, agent has not yet entered a man, but the factors favoring its interaction with the human host exist in the environment. Pathogenesis phase begins with the entry of the disease producing agent into the human host. It includes multiplication of the agent, tissue changes, clinical symptoms, and terminates in recovery, disability, or death. Levels of prevention is primordial, primary, secondary, and tertiary. Phase of the disease, objective modes of intervention. Primordial phase of disease is underlying conditions. Objective are prevent the emergence of risk factors in population group, modes of intervention, individual and mass education. Primary, pre-pathogenesis is the phase of disease. Objective is prevent disease from occurring, reduce incidence. Mode of intervention of primary prevention, health promotions, specific protection. Health promotion contain education, nutrition, lifestyle changes. Specific protection contains immunization, chemoprophylaxis, safety belts. Secondary, pathogenesis, early halt of progress of a disease at its incipient stage and prevent complications, reduce prevalence. Early diagnosis and treatment, screening test, case findings, prompt treatment. Tertiary, pathogenesis, late, reduce or limit impairments and disabilities, minimize sufferings. Disability limitation through prevent transition from impairment of handicap, rehabilitation, medical, vocational, social and psychological.